Hi Colleen, it's Hannah, student physical therapy. I've been working with you for several weeks now, and I just wanted to ask for your consent if it's okay if I work with you today. Perfect, thank you. So I know you must be super excited to be able to be done with your antibiotic therapy and to undergo the treatment so that way we can get all this fixed and get you back into your normal everyday life. I know you're going to be excited whenever that comes up. I do have a few exercises that I do want to show you. I'm going to show you 3 different categories of this exercise. I'm going to show you a basic level, I'm going to show you an easier level, and then a harder level. So it would be great if we start these today and then you do them up until surgery. And then after surgery, you'll have a protocol that you'll have to follow as well. But you can always start with the really, really easy one that we're going to do today. That's a typical exercise that physical therapists will give you, but make sure that you talk with your doctor and everything before. So for exercise 1, I'd like you to be able to do 2 rounds of 10 repetitions. I'd like you to be at an RPE of 5 to 6, and I'd like you to do it 2 to 3 times a week, okay? It's going to look just like this. Contralateral leg is flexed. We got this leg straight. We're going into a heel slide with resistance, and then slowly eccentric control back down with a little bit of resistance. So for our progression, if that was way too easy, I'd like you to do this next exercise. I'd like you to do 3 rounds of 5 repetitions once you had an RPE of between 6 and 7. And I'd like you to do it 2 to 3 times a week. It's just up to how strong you're feeling and how well you're feeling. Okay, it's gonna look just like this. Like her ankle to be at 90 degrees. So she's kind of trying to pull her toes towards her a little bit. Dragging the heel, we feel resistance. We're parallel with the contralateral leg. Now I want her to try and bring her knee closer to her. That way we're at 90 degrees of hip flexion and knee flexion. If she's not at this range of motion at her knee, you can just do what you can. So Colleen, if both of those are just too difficult for this time, I have a backup plan. So this exercise that I'm going to show you, I'd like you to do 2 sets of 8, just nice and slow. And all we're going to have you do is really just try and bend this knee, bring the heel towards your bottom, okay? So I'd like you to do it 3 to 4 times a week at your speed. I'd like it to be an RPE of 3 or 4, okay? This is what it looks like. So this band is crossed like an X underneath the knee. So that way she has something to hold on to. She's lying down. Contralateral side is flexed. Using her hands to help draw her heel to her bottom. Bending that knee. And then straightening it back out. And for any reason, if this was too easy, but she needed a middle ground between this and the one we started with initially, she could add some resistance with her hands while going back down to push against, helping her come up, and then holding this, her legs pushing against her own resistance. So Colleen's goal is just to stay as functional as she can. She was really wanting to get back as close as to normal before this second surgery, so I'm sure that that's going to be her goal afterwards. And I think these exercises can really help her maintain her strength as well as progress her strength post-surgery. And we're targeting hip flexors, quads, hamstrings, even some anterior tib, and some glute stabilizers as well. We're throwing in concentric, eccentric movements as well as isometric movements. And I really think all of this is going to tie in and help with inflammation. It's going to help with creating a muscle pump to be able to keep the systemic blood flow pumping throughout the body. I think these exercises are just going to help her body prep for what's coming through surgery, and it'll also give her a better chance of getting back on her feet a lot quicker because of all this hard work that she's put in and for all the strength that we've been building.